On, we finish anticholinergic, very important anticholinergic, contraindicated if your patient is not passing BM and BPH. And also atropine, you use it in eye drops to dilate, and probentin, you use it when you have muscle spasm, and scopolamine, you use it to dry up the mouth fluid. Are we clear? The meaning is anticholinergic, it does dry up the body fluid. Second drug, we have anticoagulant. Anticoagulant is blocking. This is important. Underline the word, how does it convert prothrombin to thrombin? That's important. Pulmonary embolism, MI patient, you can give them. And the heparin. How do you give heparin? And we will go on the next slide. And what do you monitor? Bleeding, hematuria. What lab do you do? PTT. Normal 20 to 45 seconds. And therapeutic level 1.5 to 2.5. And antidote, protamine sulfate. How do you give? Sub-Q or IV. No IM. Only sub-Q and IV. And anticoagulant, another medication, Coumadin. Coumadin is, underline the word, synthesis of vitamin K. It synthesizes vitamin K. Underline the word pulmonary embolism. You can give them maybe after MI treatment. And what do you monitor? PT-INR. Write down the word INR. 9 to 12 seconds. PT. And what is the antidote? Vitamin K. How do you give them? PO, last line. And write down the word afternoon. They'll prefer to give Coumadin like 4 o'clock in the afternoon, 4 p.m. or 5 p.m. afternoon. I will go on. So you must know your heparin, you know your Coumadin. Now you're going in and seizure medication. What are your seizure medication? Are Dilantin, luminol, Depakote, tegretolol, clonopin, and add their phenobarbital. Phenobarbital, write down phenobarbital. And phenobarbital is used in pregnancy. If somebody is pregnant, they don't give Dilantin, but they will give phenobarbital. What do you monitor patient when you have this seizure medication? Underline the word respiratory depression. Gingival hyperplasia is for your patient with Dilantin. Sub-medication chemicals can cause aplastic anemia, ataxia, and I want you to add there nystagmus. Nystagmus. Remember what is nystagmus is? Abnormal eye movement. So nystagmus, abnormal eye movement. Also, I want you guys have already respiratory depression, drowsiness. So you are giving medication, they are sleepy, they are sedated, abnormal eye movement, ataxia, all are seizure problem, and it depresses the central nervous system. Do not discontinue abruptly. Underline the word monitor seizure. Cautious with use of medication, Maui. Don't give Maui medication with that. Underline the word may turn urine pinkish color. Some of the drug can turn the color of the urine. But everyone, Dilantin, we must know what is Dilantin is causing here, is gingival hyperplasia. You have Dilantin, luminol, tegretolol, clonopin, and I said add there phenobarbital. Phenobarbital is used in pregnancy. You don't give them Dilantin, and you can give them phenobarbital. Next is page Maui medication. Now remember 3 drugs. What is Maui medication? Are Marpalane. And remember in the Spiderman package, when I say the word is called Panama, P-A-N-A-M-A. PA, Paranate, Nardil, and Marpalane. Are we clear? So you can write down there, Panama word, or remember, you got to know the medication, because when you get a question in exam, they're going to say patient is taking Marpeline, patient is taking Nardil, patient is taking Paranate. What does you monitor? Underline the word hypertensive crisis, and they become stiff neck. If they are taking food with tyramine, that's important. You do not give them tyramine in their food. What is the food containing tyramine? Cheese, aged cheese, liver, yogurt, herring, wine, cream, pepperoni, salami, banana, raisin, pickle. Lot of question you may have, patient has sandwich with pickle. Patient may have cheese sandwich, sour cream. Remove that from the tray. So your questions are going to be, they're not going to say Maui, they say patient is taking Paranate and patient is going to eat his lunch. What food are you going to take it out? So I want everyone, just like I said, your bipolar medication, this is your medication for depression, we call Maui. Are we clear? What is Maui means is monoamino oxide inhibitor. Now, second line, nursing intervention, avoid tyramine. We already said, food is same. Takes about 4 weeks to work. All your medication takes about at that time to work. Now, that's important. So everyone should know Maui drug. Now, I want you, antidepressant medication. What is your antidepressant medication? Or underline the word, is another group is called SSRI, selective serotonin reuptake, and it is depressed CNS and used for depression, used for OCD patient, and also bulimia. Remember, bulimia patient, those who vomit and they don't want to eat and binge, that is one of the reasons they are depression, so they treat them with depression medication. Now, what do you know the name of drugs? What are the name of the drug goes in SSRI? Your Paxil, Prozac, and Zolofat. We all hear Prozac a lot. And go on the other side. What is side effect are bowel, check for bowel, and GI upset, urinary retention. Monitor SSRI suicidal precaution. What is the best time to give them in the urine? May urine to pink, red color can change it and can be taken with meal. So SSRI, very important, you give them in the morning. What do you monitor for depression? Next drug, you have Tricyclic Action. What is your Tricyclic Action are? So these are all your depression medication. One group is called Maui, SSRI, and this. Your Norparin and Elevil, Tofranil are your drug. What are they cause? Urinary retention and suicidal. All your depression medication, remember, it takes a longer time to work, 4 to 6 weeks, and it leads to depression. Anti-diabetic medication, write down type 2, you have type 2 patient. What are the type 2 medication? You have Diabinase, Orinase, Diamylor, and Micronase. Side effect, underline the word skin, rashes. They can go hypoglycemia, but very important, GI upset mean diarrhea. All your oral antibiotic medication cause diarrhea, and they can also cause your patient with rashes. Are we okay? Now, so those are your Diabinase and all that. I skipped the insulin because we have already talked a lot about regular insulin. I want you to underline in insulin 2 to 4 hours, peak action. NPH is 6 to 12, ultra lenti 8 to 20. Those are, and the Humulin is within 2 to 12 hours, peak, they have Humulin. So these insulin, you guys make sure you look. Anti-diabetic medication we did, and do not take alcohol with diabetic medication. Are we clear? Monitor blood glucose, side effect is rashes and diarrhea. Hypoglycemia, when your patient has low blood sugar, What medication you give? Glucagon. Underline the word glucagon. Now, if they cannot drink orange juice, what do you give them? Glucagon. And what do you monitor with that? Bronchospasm, hypotension, may repeat in 15 minutes, and give carbohydrate. Prevent secondary hypoglycemia reaction. So, when your patient is hypoglycemic, you can also give glucagon. Next is anti-diarrhea medication. What are your anti-diarrhea medication? Kiopactate, Lomotil, Imodium, and Paragoric. All of them, they cause constipation and also urinary retention because they are controlling the BM, and you do not use for abdominal pain. So recognize some of your drug for your pain. Are we clear? Now let me tell you, in Lomotil, second one comes with prescription. It's a controlled medication. Are we clear? And also they are sedative. They sedate your patient and stop cramping. Now Lomotil you cannot buy over the counter. You have to have a doctor prescription. It's a narcotic and you have to count as narcotic. And monitor when you're giving these drugs for urinary retention. Give 2 hours before and 3 hours after other medication. Next medication for vomiting, Antiemetic. Which patient do you give them? Are more when your patient is having nausea and vomiting, or patient who's going for chemotherapy. Tigan, Composine, Torocan, Reglan, Antivert, and Dramamine. I want you to write down with Reglan, it causes extrapyramidal symptom, EPS. What is EPS is? Shaking. They start like a Parkinson patient, they are shaking. Underline the word, and your antiemetic medication has sedation effect, dries up the body fluid, used for chemotherapy. When used with viral infection may cause Reyes syndrome. So if your patient has viral infection, don't give these drugs because they can go in Reyes syndrome. What is a Reyes syndrome? Encephalopathy. And it happens encephalopathy when you're taking aspirin. Antifungal medication. When do we use antifungal? Underline the word candida. Your patient has candida infection. Your patient has oral thrush. Your patient has histoplasmosis, that's a fungus infection. What medication do you give them is, underline second one, very common, nystatin. Remember, you do use the nystatin. And what do you monitor when you're giving fungus medication? Thrombocytopenia and liver. And give them with food. And last line, give good oral hygiene. Remember, when you're giving nystatin, what do? Swish and swallow. Swish and swallow when you have thrush. Write down the word thrush. You can give them. And what is fungus infection? Oral thrush. Candida, sometimes you have vaginal discharge with a white vaginal discharge. That's a fungal infection. Anti-gout medication. What are the gout medication? What is it decreasing? Underline the word uric acid. What is it decreasing? Uric acid. I want you guys to know about gout. What medication do you give them? Colchicine, probenecid, and Xyloprim. So you guys need to know colchicine, probenecid, Xyloprim, and what does it cause? GI upset. And also they can cause renal stone side effect. So very important, GI upset means diarrhea. Monitor for renal stone. Give this medication with food and write down on the underneath, increase fluid. Whenever you want the kidneys to remove uric acid, you got to give food. And always remember, you guys need to know diet, purine diet. Write down on the side, what diet do you cut down? Purine. And where do you get purine? In your organ meat. Write down the word chicken, organ meat, liver, also oatmeal, very high. I want you guys to look on your purine diet. Wherever you find it, you must know. Because if you're getting a question on gout, they're going to ask you, what food are you going to give them? Are we clear? So I gave you one simple example, organ meat, oatmeal, and they also have a lot of fish, anchovies, like those. They are very high in purine diet. Antihistamine are given for allergies, underline the word allergies. And what are the medication antihistamines are? Chlorotrimeton, you buy over the counter. Benadryl, we all know. Phenergan, what does it cause? Drowsiness and dry mouth, underline the word photosensitivity. Give them with food. Sunscreen, no alcohol, no driving. Whenever you are taking antihistamine, don't drive because it causes you drowsiness. Next is antilipemic. This came in the exam. And what are those medications are for cholesterol? And it helps them to lower the cholesterol, and underline the word questran and lipid. Are some drug, questran and lipid, and what does you need to give? Because you are cutting down the fat, and in your question, it can cause constipation, and give them fat-soluble vitamin. Take HS, mostly this drug for anti-lipid medication, and also administered 4 to 6 hours with other medication. Now, lipid, questran, your cholesterol medication. Now, ACE inhibitor for your blood pressure. And what is the ACE inhibitor? Are capotin, vasotag, and write down the word pril. Ending word for ACE inhibitor is pril. Now, they have only given one name, but anything goes pril word, that is your ACE inhibitor. What do you monitor when you are giving blood pressure medication? Hypotension and dizziness. Don't give with food, and change the position slowly. And I want you to add their pril side effect is cough, dry cough. Your patients start coughing, that means they are allergic to medication. Beta blockers are your propranolol is called oral. So what is your beta blockers are? Oral. What is your pril R? Beta is pril R ACE inhibitor. What does you monitor when you are giving oral medication? Side effect, change in heart rate. Check the pulse rate. It lower the pulse rate. That's very important answer. It lower the pulse rate. Okay, next page. We will move on. And in the next page, you guys have is leave all those 2 boxes and go for tenormin and thyrotic. They're also for hypertension, and monitor for hypoglycemia. Mask the symptom for hypoglycemia. Antihypertensive medication, calcium channel blocker. Now remember, your calcium channel blocker, you can give them for angina pain, hypertension pain. And what are the name of medication? Procardia, one of them, very common. I want you to add there with Procardia, sublingual, you give them PRN for chest pain. You give them PRN for chest pain. Calin, cardizine. Now you guys have to remember the pril, beta blockers, calcium channel blocker, and pril, you're having cough, beta oral, I told you check the pulse. And what do you monitor for procardia? Hypotension, GI problem, and add their constipation. Calcium, you keep on taking too much of calcium, they're going to lead into constipation. Do not chew, because it's like a capsule, don't chew them. Or divided sustained tablet. Next is alpha adrenergic blocker. That's another hypertensive medication. Aldomate, catapres. What do you monitor? Hypotension. Mostly your blood pressure medication is going to sedate you and lower the blood pressure. And also write down, don't discontinue abruptly. Monitor for fluid retention. Write down the word CHF. Another hypertensive medication, you have hydralazine and minoxidil. Tachycardia it causes, and check the pulse. So you can make a little card, and or if you memorize from here, that's fine, but do your drugs. Antihypertensive medication, another one, you have reserpine. So everyone remember one thing. Your blood pressure medication, you got to check blood pressure, tell them to get up slowly, cut down the salt. Now bipolar medication, you have lithium. And tegretol and Depakote. Write down those two drugs in the end are seizure medication. But main drug for your bipolar is lithium. But you have tegretol and Depakote, they can use it. What do you monitor? Blood test. Side effect is polyuria and polydipsia. Next page. Give them with the fluid. Increase fluid and write down the word salt. Toxicity. What is the sign of toxicity? Nausea and vomiting, ataxia and weakness. All right. Now I will move on anti-neoplastic medication. There are cancer medication. What are your cancer medication are? Anti-neoplastic means for cancer. Underlined like leukemia, multiple myeloma means bone cancer. And cisplatin and cytoxin. Those first one and third one, very important, cisplatin and cytoxin. What do you monitor when you are giving cancer medication? Alopecia, liver, underline the word. Epistaxis, bleeding, stomatitis, and nausea and vomiting and diarrhea. Everyone highlight the word bone marrow, alopecia. All your cancer medication are going to cause alopecia. Bone marrow, what is in bone marrow? Red blood cell, white blood cell, platelet count. And underline the word GI. Underline the word GI means anorexia. They don't feel hungry. When you are getting a cancer medication, they have no appetite and good oral hygiene. And I want you to write down when they are saying patient is mouth infection, underline the word stomatitis. Comes in exam. We are nurses. All your questions are going to be based nursing. Patient has stomatitis means mouth infection. In stomatitis, if they have, write down the diet, soft diet. Avoid no fresh fruits. Canned fruits is okay. Soft fruit is okay. No toast. Don't give them toast because they are hard. No hot and not too cold. Not too hot and not too cold. Remember, if they give you have a patient with cancer and they're taking cancer medication and they have stomatitis and they have nausea and vomiting. So what do? Remember, give them soft diet. Don't give any hard food because it burns their mouth. Give them fresh fruit. Don't give no fresh fruits. Canned fruits is okay. No toast, and don't give hot and too cold. And frequent oral hygiene. You give them. And that question is important. All your cancer medication depresses the bone marrow. Are we clear? Causing nausea and vomiting, anorexia, alopecia, bleeding disorder, and good oral hygiene, and give them fluid. Are we clear? So what are the name of your medication is here? We say cisplatin and cytoxin. That's a cancer medication. Second group of anti-neoplastic medication you can give for colon cancer. 5-FU, methotrexate, common one, and Hydrea. What does it cause? Go in the third box. Same side effect, oral ulceration, bone marrow, nursing, hepato, and good oral hygiene. Next medication you will go on adramycin. Adramycin and bleomycin, those are also cancer medication. Side effect is same. In nursing consideration, highlight the word antiemetic. What drug do you give them? Antiemetic. Give them the medication to prevent nausea. Another group of anti-neoplastic medication, these are hormones, underline the word hormonal medication. And these are diethylstilbestrol, tamoxifen, testosterone. They're giving in the female breast cancer and also prostate gland cancer. They can give them. What do you monitor? Bone pain, hypercalcemia. Always remember your cancer medication increase calcium and uric acid. And also monitor CBC and calcium level. And also write down breast engorgement because it's a hormone. The breast tenderness, they can get hot and they feel very hot and flushing because they are hormone. But very important, tamoxifen in the middle one, write down for breast cancer. You can give them tamoxifen. And testosterone, and the first one you can also give them for testicular cancer. Next drug you have oncovine, another drug, and oncovine is also cause stomatitis. I want you to underline last line, xyloprim to decrease uric acid. So everyone remember, cancer medication increase calcium level and uric acid level. And what drug do you give? Gout medication. So cancer medication given with gout medication to help them to remove uric acid. Now that helps you to know your cancer chapter and cancer drug. Now I do have is your Parkinson drug. Parkinson drugs are on page 58. Is artane, cogentin, L-dopa, paraldol, cinnamate, and add their aldoprel. I always add that because that's a common drug. Aldoprel. Now when you read one book, some book have some other, so every book you're missing something. I want you to write down, it dries up the mouth in the last, dizziness, and also write down urinary retention. And add there, oh, you do have one more in the next page, Symmetrol. That's important. Now, if you will memorize some of the drugs, you are going to be good. You're already hearing some of the things you are going to do fine. And also, I want you to write down no B6. Large dose of B6 reverse the effectiveness. So write down, remember, I said do not give B6 with Parkinson, and write down no Maui. What is Maui? Is depression medication. So write down no Maui medication. And also do not give Parkinson medication if they have glaucoma. And also write down monitor low blood pressure. Orthostatic hypotension. Mostly your Parkinson drug also cause orthostatic hypotension. So you got to monitor for your patient here. Next is, I'm going to move on, antiplatelet. That's a blood thinner drug. Aspirin, presenting. What do you monitor? Hemorrhage. How do you give them? Underline the word with food. Remember, aspirin also affect your hearing on the ear. So write down the word tinnitus and hearing problem with only with aspirin. Next is psychotic medication. What are your psychotic medication? Haldol, thorazine, Maloril, stalazine, and add their prolaxin. Prolaxin is also antipsychotic medication. When you give these drugs, very important when you are giving these drugs, prolaxin and antipsychotic, underline the word. This is very important. You must make sure you memorize like that. Parkinson drug, acthesia word. What is acthesia? Inability to sit. Write down the word, they're tapping their feet. Number 2, dyskinesia, dystonia word. Parkinson syndrome. What is Parkinson syndrome? Shaking. You must know acthesia word. Tardive dyskinesia word. Involuntary movement. Dyskinesia means they are getting stiff. So write down the word stiffness. Parkinson means they are shaking. And I want you guys to also add there is EPS. They use the word EPS. EPS means is extrapyramidal symptom, involuntary movement. and also write down the word NMS. Neuroleptic Malignant Syndrome. And what does that mean? They become very stiff, they have high fever, and also the blood pressure goes up. So what do? Is you stop the medication. Don't give the medication, stop medication. All right, so what are we doing here? Stop medication. We are on same package, page 59, and we are on antipsychotic medication. Antipsychotic medication, very important for Nclex. And ectasia word, they cannot sit quiet. Dyskinesia, dystonia word, they become stiff. Tardive dyskinesia means involuntary movement. And also I added these two on the side, EPS word, extrapyramidal symptom, and neuroleptic malignant syndrome, that goes with psychotic, we talked earlier, but you got to put together. Are we clear? And so those are side effects of your antipsychotic. You're giving for behavior, and what do you give to help for EPS? What drug do you give to help them for EPS? Write down the word. What are the ones we are giving? Cogentin, Artane, and Benadryl. So doctor give them these drugs to prevent from extrapyramidal symptom. So page number 59, antipsychotic medication, ectasia where you have tapping feet. They cannot sit, they tap their feet. Dyskinesia means they become stiff. Tardive dyskinesia is very important, that they start shaking. And also EPS, they use the word. Are we clear? Neuroleptic malignant syndrome, you stop the medication, give them fluid. Don't pick up your answer to call a doctor. I think you guys have also some more side effect underneath. Clozaril, Risperdal, you guys have extrapyramidal symptom. Anticholinergic means they dry mouth. Orthostatic hypotension means they lower the blood pressure. So everyone, you are treating your patient with psychotic medication, but it lowers the blood pressure, they start shaking, they're going neuroleptic malignant syndrome, and also anticholinergic means we are nurses. We got to be sure that our patients are drinking a lot of water. Why? Because it dries up. And what do you prevent them from fall? Because orthostatic hypotension, they're very sedative. Then you go in the last is sunscreening. Some of your drug, you affect them on sunscreening. That means you are preventing them from going out. So is photosensitivity. Antipyretic for fever. What drug do we use for fever? Tylenol. And what does Tylenol affect? Underline the word liver. Aspirin is contraindicated in the children because aspirin can cause what? Reyes syndrome. Underline that word. And what is Reyes syndrome is, write down the word encephalopathy and ICP. What does encephalopathy mean? It affects the brain. So if they give you a question, what do you monitor if somebody has Reyes syndrome? I will write down the word encephalopathy, and also what do you monitor with encephalopathy is liver. In encephalopathy, ICP, level of consciousness, and it damages the liver. So aspirin you're giving, and aspirin can lead to encephalopathy. And remember, viral infection. If somebody has viral infection and you're giving aspirin, they're going to get encephalopathy. Are we clear? So aspirin can cause what? Reyes syndrome. And that goes in question with Reyes syndrome. Next is anti-thyroid medication. What is anti-thyroid means? Anti-thyroid, grave disease. Write down the word grave disease. Or write down the word hyperthyroid. What are the medication you have? Tapazole, SSKI. Write down the word potassium iodide. Potassium iodine you are giving. And I want you to write down the word. What is tapazole you have is also, you are giving them other medication for your patient, PTU. Write down PTU is called Prothyrosil. That's your PTU. And tapazole, write down together. These two drugs you are giving for thyroid storm. So if there is a question, your patient has thyroid storm, what drug do you give them? You give them PTU, Prothyrosil, and tapazole. Are we clear? But what are the other drugs you have for thyroid patient, hyperthyroid? Add another one, Lugol solution. Potassium iodide, SSKI, is a potassium iodide. And you're giving iodine. If they ask you what electrolytes do you give for thyroid patient, iodine. Are we clear? So iodine is there, potassium iodide is there, tapazole is there, and your medication is PTU. And which patient are you giving? Hyperthyroid. You've got to memorize. Which patient has thyroid storm after thyroidectomy surgery? So what is a thyroid storm? That means they become more hyper. It's not hypo. Always remember, they turn into hyper. They have too much of thyroxine in their body. And what do you monitor for hyperthyroid? Write down, they're very hot. Hyperthermia. I'm covering your thyroid gland at the same time. They're very hot. Hyperthermia. Their blood pressure is very high. And they have diarrhea. And they're very nervous people. And tachycardia. So what is hyperthyroid? These are the symptoms for hyper, but when they have thyroidectomy or they become sick, what happens? They can go in thyroid storm. Thyroid storm is a complication of grave disease. What drug are you going to give them? PTU, tapazole, and potassium iodide and Lugol solution. You give them these drugs. Now, what do you monitor for these drugs are side effect. Is leukopenia, white blood count, thrombocytopenia, they can bleed. Underline the word bitter taste. Anything with the bad taste, that means side effect. You got to notify the doctor. And give them with meals. And check CBC whenever you are giving this medication. I want you guys, and where you wrote it down, Lugol solution, I want you to write down mix with milk or juice and use a straw. Now, if they ask you, doctor has ordered before thyroidectomy is Lugol solution or PTU. Before surgery, why are you giving anti-thyroid medication? So patient is going for thyroidectomy, but doctor has ordered, your answer is going to be reducing thyroid hormone. What are you reducing? Thyroid hormone. And second thing, decreasing vascularity. What is the meaning? Vascularity is the bleeding. What are you reducing here? Is the bleeding. Are we clear? So there are two purposes. Your question can be, doctor has ordered Lugol solution. How do you give them? It's not a tablet, it's a liquid. You mix it with the milk and a juice and give them with a straw. Are we clear? And also they ask you, why are you giving before thyroidectomy? Your answer would be, anti-thyroid means they're reducing the thyroid hormone and they're preventing from bleeding. That is the purpose. But what does the bleeding mean? Vascularity. Underline the word thyroid replacement or write down thyroid hormone. That is given for mixed edema patient on hypo. I want you guys add there hypo and mixed edema patients, or you're giving them. And what medication do you give? You guys have two drugs, Synthroid and Cytomol, and add one more, and it's called Thyroid Armor. Thyroid Armor, you can give them. And that is to lower the, is to increasing the thyroid. So it's called thyroid hormone. So what are we giving here? Thyroid hormone to the patient. Which patient? Write down hypo and write down mixed edema. And also after thyroidectomy question, patient has thyroidectomy, patient is going home and doctor has ordered thyroid hormone. Are we clear? So what is thyroid hormone? You're giving when you don't have hormone. But wording, sometimes you don't get the wording and you're looking question and you don't know what drug are they talking about. So they're not going to give name of drug, but sometimes that. And also what do you monitor? They're turning into hyper. So what would be the side effect? Nervousness, tachycardia, and then we go on next page is weight loss. As you're giving thyroid hormone, hypo people gain weight. You start losing weight. And I want you to write down underneath, check the pulse, very important before you give thyroid hormone. And also, now I don't want you to remember all those with the drug interaction, very important, write down there. For thyroid hormone, check the pulse. If patient feel tachycardia, chest pain, and write down the word nervousness, they need to notify the doctor because they're turning into hyper and they got to adjust the dose. If pulse is 100 or more than 100, hold the medication. So you got to know what do you teach your patient when you're giving these medication. They're going to turn into an early morning, empty stomach. When do you give this drug? Early morning and empty stomach. Are we okay? So everyone should know these some of your medication. We talked about hypothyroid, and now I will move on page 61. 61, your TB medication. What are your TB medication? INH. What is another name for INH? Isoniazid. Write down that. Sometimes they only give this word. And TB medication are ethambutol, very important. Streptomycin. I want you to add rifampin, another drug. Rifampin. I want you, these are your drugs, very important. INH, ethambutol, streptomycin, rifampin. If you remember PAS and the other, but these four are very important. What do you monitor when you give your TB medication? Underline the word liver, hepatitis. So it can damage the liver. And peripheral neuritis. What is peripheral neuritis? Tingling sensation, nerve problem. What do you tell your patient who has tingling sensation? Is give B6. What is B6? Pyridoxine. Peripheral to prevent peripheral neuritis. So everyone remember, INH affect lower what? B6. And what does it cause? Peripheral neuritis. So what you are going to teach them to take it is B6. What does it cause? Liver problem, hepatitis. I want you to write down in the center ethambutol. When you are giving ethambutol, the second one under INH, it causes eye problem, vision, check their eyes when you are giving second drug. Then rifampin, I want you to write down the color of the urine become orange color. Write down that. Now only the main thing I want you to add there, ethambutol, check the eyes because they lower the vision, and rifampin changes the color of the urine like an orange color. Are we clear? Streptomycin, when you're giving, it's affect the ear. Streptomycin. And streptomycin is given injection. So these are your TB. And TB medication are given 6 to 9 months for preventive purpose. Antiviral medication, you are giving for which patient? Antiviral. In the first box is HIV infection. Your HIV comes from what? Is your virus. What are your virus medication are? Zovirax, AZT, Videx, Famavimar, or Cytovine. Cytovine is very common drug to treat your, and remember you have cancer. Cancer are with virus also. So Cytovine can be used as a cancer medication, and Zovirax and AZT, acyclovir we use it, and you're using, and remember your virus medication ending word, some of them has vir. Write down the word vir, V-I-R. And what do you monitor when you're giving viral medication? Underline the word GI. What is GI problem means? Diarrhea, dizziness, and write down with dizziness, seizure. They can go into seizure. So very important, they can go diarrhea, you check their bowel movement, check their GI, check the headache, dizziness, and seizure. What do you encourage your patient when you're giving their medication? Fluids. And these medications are not curing HIV, but what are they doing? Relieving the symptoms. So everyone remember is when you're giving is Zovirax, AZT, they don't cure the HIV, but what does they do? They lower the symptom. Next medication, ADHD, Attention Deficit Disorder. Attention disorder, hyperactive child. What medication do you give them? Ritalin, Cylert, C-Y-L-E-R-T, and Dexedrine. Remember, they are stimulant. So what are these drugs are called? Write down the word stimulant. Side effects are insomnia, very important, insomnia, and restlessness. Underline the word palpitation. Underline the word is monitor the growth. It affects their growth. And give them in the morning because they cannot sleep. And I want you to write down there no coffee, no tea, and no cola. So where you say monitor growth, I want you to add there drug holiday. What is a drug holiday? A skip a day. So drug holiday means you are giving Monday to Friday, but no Saturday and Sunday. So drug holiday means is you skip a day or two. Why? Because they will not grow properly. So you don't want to give them daily. Everyone, Dexedrine, Ritalin, these are hyperactive children. These are stimulant. You do not give coffee, do not give cola. What do you monitor for them? Are their growth, and give them in the morning so they can sleep. Are we okay? All right. Next is bronchodilator. You are giving for which patient? When they are having a breathing problem. Asthma patient, you can give them. Patient with COPD, you can give them. And underline the word preterm labor. Mother is going in early labor. You give them the medication. What medication? Terbutaline. And they also give Breathin in the second box. That goes in OB question. Mother is having a labor. You give Pitocin to start labor. But when mother is going in early labor and you want to stop, what medication do you give? Your answer would be terbutaline and Breathin. Are we clear? So make sure you say OB in OB. And aminophylline, Atrovent, Breathin, Proventil, these are all your bronchodilator. Side effect, very important. All our patient has asthma, breathing problem. So what is the side effect do you monitor? Tachycardia. Their pulse rate goes very high. Tachycardia. Dysarrhythmia, abnormal heartbeat, palpitation. And I want you to write down nervousness. What do you monitor when you're giving this drug? Their heart rate. And also, when used, inhaler use bronchodilator first may aggravate. Underline the word diabetes. Bronchodilator affect the blood sugar. So check their blood sugar. And also, I want you to write down on the side, no coffee. Avoid stimulant because they are already having tachycardia. Don't let them drink a lot of coffee. Check for already if they have heart problem. If you have hyperthyroid, your pulse is already high. And write down cardiac problem. Hyperthyroid patient, be very careful. Any cardiac problem because it increasing their heart rate. Are we okay? What is it increasing here? The heart rate. Next is you have glucosides. What is glucosides? Are your lanoxin. So when they give you lanoxin and digoxin, underline the side effect bradycardia, nausea and vomiting. Visual. What is visual means? Visual means eye halos around the eyes and they cannot see. And add their potassium level. Lower the potassium. So when you are taking digoxin, you must check the potassium level because it's lower. What is a normal dig level? 0.5 to 2.0. More than 2.0, your patient is in toxicity. What do you check when you are giving digoxin? Apical pulse. When your patient is going home, then you do radial pulse. Are we clear? Apical pulse and radial pulse. So, and that is your for apical pulse. Next page, I will move on. You do have in the next page apical pulse. Notify physician, read those at pulse and monitor potassium level. Cholinergic medication, I did that. When do you give this drug? Underline the word Myasthenia gravis. I just did today also and yesterday. And what is those medication are? Tensolon, prostagmin, and write down another name, mastinon. So write down one more, mastinon. So write down, that's another drug. Everyone remember, these are the drugs you are giving for your patient with, which patient you are giving? Myasthenia gravis. Underline the word, side effect are bronchoconstriction, respiratory paralysis, very important, hypotension. Side effect, hypotension. How do you give them? With food and milk. Antidote, if you get too much, then you give atropine sulfate. What is too much of medication? Word is called cholinergic crisis. Write down the word cholinergic crisis. So if your patient is having too much of medication, cholinergic crisis, that means they have too much of medication. Antidote, you will go for atropine sulfate. We did today also. Toxicity can cause is abdominal pain and cramping. Okay, I will finish till diuretics and then we will stop. Diuretics are your medication hydrodiuryl and Diamox. Then you have aldactone. Aldactone is your potassium sparing one. So write down aldactone. Hygrotone and Lasix, and add one more, Adrenergic. So add there, Adrenergic is another Adrenergic. You had in the first page, we did it. And Adrenergic, Lasix, they both are loop diuretics. So make sure write down with Lasix and Adrenergic, they affect loop diuretic, and that means they affect the kidney. What do you lose? Mostly all your medication are potassium. Remember that, you lose potassium. Underline the word orthostatic hypotension. You are taking out a lot of fluid. The blood pressure is going to drop. And give them with food or milk. Take in AM. Never take your Lasix and medication later. Now, aldactone is your potassium sparing diuretic, and you give them for Cushing patients. Are we clear? Because they have low potassium. Now, iron in the bottom, it says Imfron, Fiosol. That's a iron. If you're taking oral, use straw. And no milk, empty stomach is good, and that would be for your iron. In front, you also give Z-Track injection. How do you give iron? Z-Track injection. Glucocorticoid are your medication, ending word zone and salon. Who do you give as steroids? Your Addison patients, your Crohn's disease patient, COPD patient, you can give them, and these are your name. What do you monitor when you're giving steroids? Are psychosis, their mental problem, depression, hypokalemia, they lower the potassium, stunt growth, monitor electrolytes, monitor for sign of infection, write down, prevent them from getting infection. I think I'm going to stop here for today, and then I will see you back on Wednesday, and we'll start on page 64, and then we'll continue.